Today we are talking to Dr. Keough, Dr. Felicity Keough with Keough Chiropractic in St. Charles, Missouri. Thank you for joining us. And I would like to ask you about chiropractic care. So I know you're passionate about functional health, and you've just changed my life through that approach, and I appreciate it. But you've also helped me with chiropractic care. So, and before we turn the mic over to you, Dr. Keough, you know that I was terrified of chiropractors. So I was 40-something years old before I went to a chiropractor for the first time, and it was you. Do you remember what happened?
I do. I could never forget it.
I cried. I cried and I was nervous, and it was a wonderful experience, and I want to thank you for that. And I also want to say that one of the reasons that I didn't see a chiropractor sooner was because I didn't see the validity in the practice, honestly. I didn't. And looking back at it now and all the research that I've done, just the fact that insurance pays for chiropractic care means that it helps. And it eliminates a lot of other medical bills. And that's why insurance covers the service, because it does help. And it's a lot less expensive in many instances. And I'm speaking as a consumer, not as a chiropractor. So can you tell us a little bit more about chiropractic care?
Sure. And I do remember that first adjustment, and watching your range of motion in your neck go from this to like full was incredible. So I'll never forget that adjustment. And you were
10 years. I had been stuck for 10 years. But of course my muscles are still sore because I can move my neck now, and I couldn't before. So for 10 years these muscles went unused, and now thanks to you they're sore because I get to use them.
You're welcome.
Thank you.
Chiropractic is, it was established in 1895, so, a little while ago.
Wow.
And it's really had its challenges through the years. One thing in particular that I think of is, I believe it was around late 1970s, where the AMA was really trying to contain and eliminate chiropractic. They were trying to discredit the schools, keep us out of health insurance and from taking workman's comp, and really just kind of do away with the chiropractors. And I suppose they felt threatened by chiropractic. I don't exactly know, but I would assume that's probably what was going on. And so there was a chiropractor who his last name was Wilk, and he basically sued the AMA, and it took some time, but he won. And that was 30 years ago. And it's incredible today to see the changes in chiropractic. We're in network with insurance, and we're taking workman's comp. There's chiropractors in hospitals doing radiology, and it's just incredible to see how the profession has advanced and how it's changed. And really, chiropractors are not competing with medical doctors.
No.
We're just not. We don't want to be medical doctors. We want medical doctors to do what they do, and we want to do what we do. So, because we do two totally different things. We help the body. We find the imbalances, the misalignments in the patient's spine. We address those using the chiropractic adjustment, and the body works to start healing itself. So we're treating the spine, and medical doctors are, treating different conditions, in a totally different way. So no competition.
I respect the respect that you have for the medical doctors as well, because in your diagnosing me, you've referred me to a couple of different types of doctors. So you work hand in hand with them. And I really appreciate that. It took a lot of the fear out of that for me, because I kind of felt, because I have some friends that say, oh, I don't go to medical doctors, I just go to my functional health doctor. And I'm not saying that that's good or bad, but for me, I needed both.
And a lot of people do. And it's just so important that all providers work together, in my opinion. And I wish that, not everybody feels that way, but my my hope is that all doctors can work together. Medical doctors continue to refer. Some do refer to us. Hopefully that we can get that, hopefully that can be more, but just referring when it's all in the best interest of the patient. So just referring where the patient needs to be is so important.
Yeah, and this is really, chiropractic care, from my interpretation of it, seems to be like a lifelong journey, really, of helping you stay healthy. I have little grandchildren that come to you, and they're so cute, these little bitty babies laying on the table, and you're adjusting my grandchildren, but I've seen challenges that they had with allergies and ear problems and runny noses and digestive issues, and they see you and that stuff gets taken care of. So
Yeah.
even from, and I think in the womb even,
Right.
you help.
Yeah, absolutely. Yeah, and it's the first adjustment really begins in the womb. And so like I'm expecting and I'm getting adjusted, at least once a week, if not twice a week, because being a chiropractor myself, my hips get misaligned, and I can tell that there's stuff going on in my womb. So having a chiropractor that specializes and is certified in how prenatal care, taking care of prenatal women that are pregnant, is really important, which is what we are in our office. And so I easily can get adjusted whenever I want, because I have 2 other doctors in my office that I can just, hey, adjust me. So that's important. And then of course the children. We're all certified to treat children. We know how the biomechanics of an infant's spine work. Very, very different than adjusting an adult. But yeah, it's so important to get adjusted when you're an infant, because the birth process too. The birth process can be pretty hard, even if it is a natural delivery. It's a guaranteed way to get misaligned. So just checking the babies when they're infants is so key to keeping their spine in line.
That's a traumatic experience, being tugged and pulled on.
Yeah.
And I was watching 2 of my granddaughters jump on the trampoline the other day, and I was thinking, I hope they have an appointment with Dr. Keough soon, because just that jarring on their little spines and the way they were falling, and just the injuries I think that we're sustaining that we don't even realize. I bumped into the side of my countertop and twisted, and it hurt for a couple weeks, and I thought, oh, maybe I need to go see Dr. Keough, and I did, and within a few weeks it felt better. But I just think daily life, we get misaligned, and I don't know the particulars of it, but my interpretation is it affects the nerves, the communication with the body.
Correct.
Tell us about that.
Right. So the spine, which is what we adjust, is it's basically housing the central nervous system. So for example, like your grandbabies jumping on a trampoline, God knows what can happen when kids jump on trampolines, right? But even if it doesn't hurt, like even if they just land a funny way, the reason that we can all move like we do is because we have a movable spine. So the spine can easily get misaligned, whether it hurts or not, and then that puts interference into the nervous system. And then from there, we can start to have malfunction somewhere in the body, and that might not even be pain. That could be like ear infections, or like in your case with your grandbabies, they had a lot of ear stuff. For some people, it could be, some kind of organ dysfunction. It could be any dysfunction, really.
It could be constipation, right? Do you remember having this conversation?
Yes.
So Dr. Keough, you showed me my x-rays, and you did the, you said, and I don't know what the numbers are. There's some numbers on my spine that you said were off, and I was having trouble with constipation, and I started seeing you for that originally. Do you remember?
Yes, yeah, I do remember.
And I believe it or not, just being adjusted over the course of a few months, it helped tremendously. I have not had problems with that since then.
And we have so many patients who that exact same thing happens. They're not necessarily interested in doing functional medicine, even though we recommend it to most of our patients, but they just start with their chiropractic care, and then they report back in 2-3 weeks that, all right, well, whatever you're doing is working because I'm more regular. I don't have acid reflux. All these things are so much better, and they haven't changed anything except for getting their spine adjusted so their body's working better is really we're not treating constipation. We're just treating the misaligned vertebra, so then the body's healing itself, and which is essentially what your body wants to do is heal itself.
Yeah, absolutely. One concern I think that I've had some of my friends and family go to varying chiropractors, like different chiropractors. If they're closer to this chiropractor,
Right.
they'll pop in. And I don't know, maybe it's okay to say this, maybe it's not. I don't really understand the practice of it, but they'll go to the chiropractor and get adjusted, but there's no testing or anything done. They just go in, 15 minutes later they come out and they've been adjusted. And for some reason, when I have gone to you and I've sent you tons of friends and family.
Yes, thank you.
They're all so happy, by the way, raving about your services. But for whatever reason, you wouldn't. I've tried to get my husband in. He doesn't want to come in to do the x-rays. And you said, I'm not going to see him. So you will not adjust until you do some type of assessments, or so, I don't know what necessarily that's all about. I'm sure there's a method to the madness, but can you tell us about that?
Sure. So we see, as we talked about earlier, our practice, we see a lot of pregnant women and children where we do not x-ray, that we don't x-ray the population of pregnant women and children, of course, unless there's been like a traumatic accident or something. Then we might find a way to do it that's safe. But normally we do x-ray because of the technique that we use. We use corrective chiropractic. So for us, it's so important to see what's going on in the spine before we lay hands on patients. I think it's important really no matter, it depends on the technique, truly. So every chiropractor is different because every chiropractor has a different technique, a different way of assessing. But for me, I like to be able to see the spine in an x-ray because, man, I just don't want to guess. I just feel like I don't want to guess. The patient doesn't want me to guess. That's so important. And we've seen a handful of really bizarre things over the years too that come up on x-ray that people are really appreciative to know about. Cancers, tumors. We've had patients that have blocked vertebra, which is basically where one vertebra fuses with the next. They're born that way. They didn't even know it. Well, that would feel a lot like a misalignment. So if a chiropractor does an x-ray that to see, that's going to feel like a misalignment, and they're going to adjust a bone that's fused with another bone. That's going to hurt.
Oh, wow.
So I just feel in my practice, I feel more comfortable having that x-ray to know. And we do other assessments too, other things, but the x-ray is such a visual for us and the patient to see.
Okay. And maybe it has to do with your personality style too that's helped create this methodology, but I know you're kind of a perfectionist.
No.
And you like to cover all your bases, and you're very detail oriented, which would describe a very strong screening and assessment that you do initially. So, but it's helped my family and I, and my friends that come to you, just because we do feel safe with you because of the attention to detail, that you pay so much attention to. So we appreciate that.
Oh, you're welcome.
Okay, well, thank you for joining us.
Thank you.
And if you all would like more information, we have some assessments and resources in the description of this video. And if you'd like to make an appointment with Dr. Keough of Keough Chiropractic, what's your phone number?
The phone number is 636-244-4994.
And we'll put more information in the description, and you can reach them that way too. So thanks for joining us.